Hello, have you ever experienced dizziness or vertigo? Or you may know it from another word that is giddiness. Now, strictly speaking, vertigo is a sense of the environment spinning around you or objects in your environment moving and you are steady or you are still. But some people can't tell whether they feel unsteady or whether the environment is moving or spinning. So the words are used very interchangeably, that is vertigo and dizziness and giddiness. Today I'm going to talk to you about vertigo and what are the common causes of vertigo. Now the common cause of sudden vertigo, the most common cause is actually benign positional vertigo. So as the name suggests, or it's commonly given in the abbreviated form as BPVV, benign paroxysmal positional vertigo. This is a benign or harmless condition which causes sudden vertigo or sudden dizziness on change in head posture. So it may occur on bending down to pick up objects. It may occur when you're lying in bed and turn your head to the left or to the right, or when you're lying in bed and you try to get up. Sometimes there's an obvious provocating factor. For example, after a head injury or after a viral infection, you may get this. This can be seen in young people. It can also be seen in older people. So this is the most common cause of sudden vertigo. Sometimes you may experience sudden vertigo after a viral infection affecting the nerves in the ear or the labyrinthine nuclei. So this viral infection of the nerves in the ear or the nuclei in the ear can cause this vertigo or dizziness, but this dizziness is not as sudden onset as benign positional vertigo. It takes a few hours to get really dizzy, and it also causes dizziness more on movement. This is caused by a viral infection, and it may take a few days for your dizziness to totally subside and go away. Now, the most dreaded cause of sudden vertigo is if you're having a stroke. You may need further testing like a CT and MRI if your history is suggestive of a stroke and if you have risk factors. So these are the three most common causes of sudden vertigo, that is benign positional vertigo, viral infection of the vestibular nuclei or viral infection of the ear, and the third cause would be a sudden stroke which can cause vertigo. So some people get recurrent episodes of dizziness or vertigo. Now these recurrent episodes, what can cause these recurrent episodes? So still the commonest is benign positional vertigo, and as I've mentioned before, it is caused by sudden movements of the head, turning left to right or bending down to pick an object. Second reason why you may have recurrent episodes of dizziness is a condition called Meniere's disease. So this is sudden dizziness, and importantly, you get tinnitus, a sound in the ear, and hearing loss. So if you have this sound, buzzing sound in the ear and hearing loss together with your dizziness, it's important to you or for you to be aware of this condition called Meniere's disease, and you should go and get yourself assessed because it may lead to progressive hearing loss. And the treatment for this condition is actually having a low salt intake. So migraine can also be a cause of recurrent dizziness in some people, but it's hard to determine this on the first episode. Sometimes after repeated testing and repeated events, it may be that you're actually having migraine that is causing your repeated dizziness or vertigo. In some patients, they don't have headache, they just present purely with dizziness. And in these patients, they should be on some form of migraine prophylaxis. So the three most common reasons for recurrent dizziness would be benign positional vertigo, a Meniere's disease, which also causes tinnitus or ringing in the ear and hearing loss, and migraine. So it's important to be aware of these conditions. I hope you've enjoyed this video. Thanks for watching, and I'll see you next time.